Assalamu alaikum viewers, this is Dr. Khawaja Saajid Aslam. I'm an orthopedic surgeon. I do hip and knee replacement, arthroscopies, fractures, backache. Today we're discussing about arthritis of the knee, osteoarthritis of the knee. This is one of the most common problem. We did quite a few programs before as well, and we keep on doing in future, just for the public awareness, because this is one of the most common problem in all over the world, and specifically in Asian country. One of the reason is in Asian country it starts earlier than in European country or America. What it is actually, osteoarthritis of the knee. If you have had a look on the X-ray, if you see two bones, thigh bone, the leg bone, there is always a space in between. This is not actually a space what we see on the X-ray or radiograph. This is where the cartilage lays down. This is it's not a bone, it's not a muscle, it's a cartilage, a sponge kind of thing. Main function of this sponge is a cushion. So both bones will not strike each other when we walk or move it. That's how it provides the cushion effect between two bones. This cushion kind of thing rubbed off over the time, specifically people who are prone, or specifically people who have genetic correlation with osteoarthritis. Or it could be destroyed because of infection, because of fracture, or multiple other reasons as well. But anyway, whatever the reason is, once is worn off, bones get closer to each other and then they rub off and then they hit each other when we walk or when we move it. That's when it starts giving you pain, it's hurting. Because of disease, it always gives pain when it's cold, when there's a winter season, or it's cold because of air condition. That is because of the disease. It gives much more pain. And this is painful only when you move it, when you walk, when you move. If you keep on resting on the bed or sitting on a chair for a long time, it doesn't give you pain most of the time. But once you start walking, when you bear weight on these joints, then it hurts, it gives pain. Most of the people, they ask, how can we prevent it? Actually, the prevention is somehow not really exists in such kind of disease. If your cartilage has been destroyed because of any sports injury or fracture, that of course you can get it treated, or you can prevent the injury. Or infection, specifically infection in the joints. If you can get early treatment of infection, you can prevent the cartilage. Because infection is one of the things which can eat up, it can destroy the cartilage very quickly. And when cartilage is destroyed, it does not grow up, it does not heal. So sooner or later you will end up with the early osteoarthritis of the joint, either as a hip or knee or any other joint. As far as aging is concerned, that is not preventable. There is genetic predisposition for this disease as well. People who have the family history, they are more prone to get arthritis of their joints. All I mean to say, there was a time when people had to live with this pain, especially in the third world countries or Asian countries, where treatment of this problem, there was no cure actually. So people either they live with this pain, only taking analgesia or stick, and they knew that this is a sign of old age, and they have to live with this for the rest of their life. But since the science has advanced, medicine has been advanced, there are a lot of diseases which are curable, a lot of treatments available. So this is one of the things where the cure is available as well. People don't have to live with this pain, with this problem for the rest of their life. They can get cure. They can completely eliminate this problem, this disease, and they don't have to take medication, painkillers for the rest of their life. They can be active part of the society. They can walk around. They can do their jobs, their leisure activities. So the ultimate, when the arthritis goes in a severe stage, an advanced stage, specifically we are talking about the knee, there is a cure which is called total knee replacement. We'll discuss in some other programs how we perform this kind of procedure. But generally speaking, I do this kind of operation without general anesthesia, without complete sleeping of the patient. We just give under spinal, give injection in the back and below umbilicus. You don't feel anything. It's very simple procedure, very good procedure, very good results in that. You can spend rest of your life very comfortable, pain-free, and without any medication. Take care of yourself and your family. On display is my contact number. In case you want to contact or discuss further, you can get the appointment. Most welcome. Thank you.